much for joining me and NeedyMeds for today's special topic webinar, Free App to Manage Health Records, presented by NeedyMeds partner, MyLinks. Now, before we get into the presentation, I'd like to offer a few quick tips so you can make the most out of it. First of all, if you do have any questions, you can go ahead and type them into that questions section of your GoToWebinar control panel. Just know that we will reserve answering questions until the end. And if we don't get a chance to answer your question, we will follow up with you by email. But of course, we will provide the contact information for both NeedyMeds and MyLinks at the end of the presentation. I also encourage you to subscribe to the NeedyMeds YouTube channel. That way you'll be notified when new content such as videos, presentations, or webinars are added. And just a reminder to go ahead and check out that handout section in your GoToWebinar control panel. So let's get started with what is NeedyMeds. For those of you that are not familiar with it, very simply put, we are a national nonprofit founded over 2 decades ago by a retired physician, Dr. Richard Sagal, and Rich is still our president. And if I didn't mention in the beginning, again, my name is Carla Delaporta, and I'm the Director of User Engagement at NeedyMeds. And what you're looking at on your screen is all of our formal wording, including our mission statement and how we achieve that mission. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. And as I said, you'll see our contact information at the end of the presentation as well. And I really always like to put up a screenshot of our homepage because really our website is the face of our organization. And it's a great opportunity for me to just point out a few things. First of all, if you're looking for healthcare savings resources, begin your search under, yes, you guessed it, the Healthcare Savings tab. If you're interested in educational information, such as ordering brochures or some of our drug discount cards, signing up for webinars, or getting on a list to receive monthly newsletters, you do that all under the Education tab right next to that Healthcare Savings tab. I did mention that this webinar is being recorded and will be available on our YouTube channel, and you can find a link to that on the top right hand of our homepage. It's a little YouTube icon with the rest of the other social media icons. It's the third one from the left. And again, I suggest subscribe because that way you'll know when new content is being added and never have to miss out on a webinar presentation. You can also check out and register for other upcoming webinars on the calendar of events on the bottom right hand of our homepage. So as you saw a couple of slides ago, a big part of our mission is educating people. And of course we do that by educating them about NeedyMeds and the resources we have, but also by letting them know about other helpful resources and our partners that can help them on their health journey, which is why we are so pleased to have our guest here with us today from MyLinks. MyLinks is the newest innovation of the PatientLink company, which is dedicated to building innovative software solutions to provide data flow between patients and their care team, improving the lives of patients and clinicians. MyLinks is a free consumer-facing application to allow patients to easily gather, manage, and share their medical information at any time from one accessible and secure locations. MyLinks is cloud-based and mobile responsive to allow patients to use any internet-enabled device. It also provides an easy way for caregivers to manage and coordinate their loved one's care among many healthcare providers, which can often be a challenge. So you can see why we're so pleased to be able to share this with NeedyMeds users. And I'm so happy to introduce you to Brian Bean, who is the MyLinks project coordinator. Brian's going to walk us through some more details about MyLinks, how to use it, and how it can help you. So let me tell you a little bit about Brian. His background is in IT, e-commerce, leadership, and most recently FHIR for the transmission of health data. Brian, as I said, works as a project manager for PatientLink, where he uses all of his previous experience to work with his team to develop cutting-edge functionality for patients. Brian held a large role in coordinating and onboarding thousands of health organizations on the MyLinks platform. So without further ado, and hopefully seamlessly, bear with us while I go ahead and pass both the mic and the screen to Brian. And as Brian gets that up and running, which he did very quickly, I will remind everybody that if you do have questions, you can go ahead and type them into that questions section of your GoToWebinar control panel. Thanks everybody for being here, and without further ado, I'm going to go ahead and pass the mic to Brian. Thanks everybody.
Thanks for the intro, Carla. Happy to be here. As Carla mentioned, I'm Brian Bean, project coordinator for MyLinks. I've worked with the MyLinks team for about 3.5 years now. I've really enjoyed helping patients unlock their data. So I'm excited to be here and show you a little bit about MyLinks. So MyLinks is a free application to help patients gather, manage, and share their health records from one secure location. So when MyLinks was first conceived, it was a tool that our owner, Debbie Willis, wanted to create to help manage her parents' health. So that's kind of what we had in mind, is we wanted to get data and display it in a way that was helpful to the patient or their caregiver. So common uses for MyLinks. Emergencies. Obviously, you'd probably want to get your data and share it with your loved ones before the emergency, but it's a great way to keep people in the know about your medications, your allergies, and things like that. Another big reason to use MyLinks is to identify errors. So medical errors are responsible for 250,000 deaths each year. 70% of EHR notes have at least one error, with an average of 7.8 errors per patient. As you can imagine, you probably don't want doctors making big decisions about your health with invalid data. Another reason to use MyLinks is that to be able to confirm and remember next steps of your treatment plan. Reviewing your records in MyLinks may help you stay on track with your current care plans. MyLinks also gives you a single place to store your family's records. Family members can link accounts as needed. Some family members might take care of accounts for other family members, so a lot of flexibility there. You can also access MyLinks from anywhere, from a phone, a tablet, a PC, anywhere you have internet. A big feature of MyLinks is the ability to share records. So you can share your records with whomever you wish. Statistics show that 20% of your doctors will not have a copy of your record from another provider when you arrive for their appointment. With MyLinks, you could have that data handy and provide it to your doctor right then and there. If your clinic moves to a new electronic health record system, you may lose all of those old records for that provider. So downloading them into MyLinks gives them a good place to stay safe for you. And then you can also store documents in MyLinks. MyLinks gives you a place to store, anything you can upload: images, driver's license, scan, insurance cards, or maybe medical records that didn't necessarily get ingested through MyLinks. Maybe you got a file from your doctor that you wanted to store. So there's a documents area where you can store that. So there's a lot of laws that really make the patient centric in their care. A lot of this is new and becoming effective. The information blocking rule just became effective at the end of 2020. So these mandates basically encourage providers and electronic health record providers and health IT folks to give patients the access they need to their data. So it's really the digital transformation of our medical records, and it's really exciting stuff. And so these mandates and laws is what enables MyLinks, to help patients gather their records from their providers. So this is a look at the available data elements that you might receive in MyLinks. What you're looking at here is called USCDI version 1. It stands for United States Core Data for Interoperability. These data elements were basically, identified by the government as the core set of data that should be transmitted for a patient. So these are really the data elements we try to capture for you and get in front of you so you can better engage with your healthcare. Your data in the cloud. So this is where your data is and where it can be. MyLinks can help you pull data from your providers, insurers, and wearable devices and aggregate that data in your MyLinks account. When you go to a doctor, he or she will most likely run tests, take notes, and enter them into an EHR, or an electronic health record system. 85% of clinics report using a certified EHR, so it's likely that your data is stored in one. Traditionally, patients would see their data in the clinic's patient portal, but due to the new mandates and laws that I just showed, EHRs and providers have been tasked with making that patient data available to the patient using an app of their choosing. Not only do they have to make that data available, but they have also been provided the data elements as a guideline of what they should provide. We've been connecting to EHRs for a couple of years now. We've connected to as many as we possibly can and continue to connect to new ones every day. We have about 37,000 locations for a patient to get their data from, and adding to that number every day. So here's how you can get your data in MyLinks. First, you would need to create a MyLinks account. Next, and this is free, easy to set up, pretty standard, like you'd see on any other website. But next, you need to search for your hospital, clinic, or provider on the Gather page of MyLinks. Once you've found your connection, you can click it and a patient portal will launch, and you'll simply authenticate with your patient portal username and password that you've established when you set up the patient portal account with your provider. You'll follow the prompts, and then your records will be imported into MyLinks, where you can review, update them, and share them. This is the Gather page in MyLinks, where you can easily search for your clinic or healthcare provider and get data from them. Once you find your connection, you'd click Get Health Record and authenticate against the patient portal that pops up. Then your data will be imported into MyLinks for review. And here's an example of what your MyLinks account may look like after you import records. Like most people, you may have more than one patient portal account or data sources. That's not a problem. Simply repeat the steps we discussed previously for any other connections, and the data will be combined with any data you already had in your MyLinks account. Each record gets tagged with a record source, so you know where the record came from and when it was imported. You can click on a category to see more details about a record in that category. You'll also have the ability to modify or delete records as needed. Once you have your records, you can easily share them with doctors, family, or anyone you need to. MyLinks has lots of ways for you to share your data, including a 24-hour access link that you can generate at any time. No login is required for the recipient, so it's very easy to share. We've partnered up with NeedyMeds to offer patients more resources to help them save money on prescriptions, find affordable care, community support, and more. When we first learned of the prospect of partnering with NeedyMeds, we were super excited. NeedyMeds offered a vast number of helpful resources to patients that we didn't have. Once we understood how helpful all these resources were to a patient, we knew we had to include it in MyLinks. From the MyLinks account, you can find NeedyMeds information in the Healthcare and Savings and Resources page. That button will take you here, where you can find more information about the NeedyMeds resources and helpful links. So what's next for MyLinks? Currently, we're working on building the ability for patients to get their insurance claims and explanation of benefits data. We're also implementing a refresh token ability that will reduce the number of logins needed from a patient to get their data. We're developing a research trials search where patients can search for trials and learn how to participate in them if they'd like to. Lastly, we listen to our users and try to implement features that will help. If you have any feature suggestions, feel free to reach us at support@mylinks.com. Now that you have some background about MyLinks, I'd like to show you a live demo so you can see it in action.
Thank you so much, Brian. Really looking forward to seeing that live demo, which is super helpful. I had the opportunity of Brian showing that to me earlier, and it really does help seeing it in real time. So enjoy this next part of the presentation, just popping up to remind everybody that feel free to ask questions at any time. I do see a few have already come in. And again, if we don't answer your question now, we will certainly follow up with you via email. Thanks for letting me interrupt you really quickly. I'll pass the mic back to you, Brian.
Perfect. Thanks, Carla. So here I'm logged in to kind of a test account, Janet Sanderson, so fake person. So I'm logged into her account, and I'm going to go get records from an endpoint that she's already used. And when I say endpoint, I mean connection. So I'm going to try a connection she's already used. So for just starting out, you log into your account. You can go to Health Record and then Gather. My internet's a little slow, so forgive me. But on this page, you can search for your clinic, hospital, healthcare provider, and find their connection. So in her case, she was at a ZX oncology clinic, with another, fake clinic. So I pull up this clinic and I can click Get Health Record, and a patient portal pulls up. So I'll enter my credentials for Janet. Now that I've been authenticated, in the background, MyLinks made a bunch of what are called FHIR calls. So FHIR is a standardization or language that we use to transmit data from EHRs, electronic health record providers, to MyLinks. This language is kind of a universal language. So this will help facilitate the transmission of data across the health network, basically. So I expect we'll get more data as time goes on. So in this case, Janet already had some data from ZX Oncology, but she got some new records from them. So it looks like she got a new condition, a malignant neoplasm of upper outer quadrant of right female breast, and she got two new vital sign records. If you click in here, you can see a little bit more about the records that were pulled in. And you can see where the records came from. So this record came from GW Medical Faculty Associates, and it was imported in 2020. And then you can see these were imported today. And it's really that simple. So as long as you have your patient portal account, you can simply go to the Gather page, search for your clinic, enter your patient portal information, and get your data. Thank you for letting me show you a little bit about MyLinks.
Brian, fantastic. Thank you so much. I really appreciated as you said, the history of MyLinks and explaining why it came about as a new resource for PatientLink. I really love that story that Debbie was inspired to create this because she realized that she needed help coordinating her parents' healthcare information, and that is something that's so relatable. And the other things that really stuck out to me is, first of all, in the beginning when you said how errors are so common in health records, something that I certainly am guilty of overlooking and not paying enough attention to. But I really like that the trajectory of where MyLinks is going, and one of the crucial steps is user feedback. I think that's really important because building this platform, the truth is the only way to know what users and patients needs is to ask them. So that's super helpful, and I'm really glad you had the idea of sharing what MyLinks looks like in real time, because For me, that's the way I learn, and we've heard from NeedyMeds users that they find live demonstrations helpful, but it really brings home how intuitive and easy it is to use. Sometimes when people talk about a new application, to be honest, I'm a little hesitant, but once I see it and I know, oh, that's easy, I can actually do it, I am more inclined to use it and share it with my family and friends. So as I said, I do see a ton of questions coming in. And before we ask Brian to get to those, I will remind everybody that NeedyMeds is also here as a source of support. As Brian said, my NeedyMeds information and the healthcare savings resources we have can now be found through their platform, which is super helpful. You can also find them under the Healthcare Savings tab that I pointed out in the beginning of the presentation on needymeds.org. And there are some of the most popular ones you're looking at on your screen right now. If you'd like to learn more about that, spend some time browsing our website, or join us for a monthly overview webinar. It's about a half hour explaining how to find what you need on NeedyMeds. And don't hesitate to reach out to our call center counselors. And again, I'll provide that information at the end of the presentation. I know I've said this a bunch of times, but you can ask me or Brian questions by typing them into the questions section of your GoToWebinar control panel. We're going to get to those right now. And as we do, I want to leave up the contact information for MyLinks and NeedyMeds. So Brian, we did get a bunch of questions coming in, and just a quick glance, it looks like some you probably get regularly. So I'm so glad our audience is participating with asking these questions. And the first one popping up was, what if I don't have a patient portal username and password for one of my providers? That's a good question.
Yeah, definitely. Question comes up quite often. So typically, you should be able to go to your provider's website and register a patient portal account with them if you haven't already. Some clinics, if they don't have a self-register option on their website, you might have to give them a call and provide your email address, and then you'll get connected over email. So yeah, you'll need a patient portal account, because that patient portal account is what authenticates you, and it also identifies who you are to that provider. So that allows them to release the data through the FHIR API to MyLinks to you.
That makes so much sense. And I love that question, because it's certainly one I would think of myself, and I'm sure others would as well. Another question coming in, this is a good one. What does MyLinks do with my data?
So nothing. Basically, the only time we do anything with your data is when you engage a feature of MyLinks. So we don't sell your data, we don't share your data, we don't do anything like that. We try to be very, very clear about what's happening with your data. We really look at the MyLinks platform as a platform for patients. I know my team are all on the platform as patients. We look at our data, we think it's pretty cool. We like to see, the development of FHIR and MyLinks over time, and how the records have gotten more rich over time. But yeah, so all of our developers are on the platform. We all feel, security is top priority for us, since we are also patients on the platform. Yeah. So yeah, and there's a lot of cool new things coming with the research trials. There'll be options to, if you want to submit your record to these trial matching services, you can do so. And basically the trial matching services will look at your data and say, hey, you might apply, you might be eligible for these 10 trials. And so that's kind of the next thing we're working on. And a big part of that is we want to make sure we're being clear that, this is your data, and you're shipping de-identified data off to a service that's going to return trial matches. So we're kind of working through that with patients right now, trying to come up with the best way to make sure we're clear and getting good consent.
So important, such an important question and a very thorough answer. And one of the big reasons why NeedyMeds was so confident with partnering with MyLinks, because not only do our missions align, but our president, Dr. Rich Sagal, when he founded NeedyMeds, really believed in that people should be able to access the information they need through NeedyMeds, not only free, but anonymously. So I will mirror Brian's answer for Mylinks, which is, what does NeedyMeds do with the data? And the answer also is nothing. We do not sell any data, nor do we market it. And that's also, like I said, one of the reasons we were so excited about the partnership with Mylinks. And here's another question coming. Oh, go ahead, Brian.
Just to add to that, health applications will usually get approached by the Caring Alliance, or they may know of the Caring Alliance. So Mylinks is part of the Caring Alliance, and what it is they've created a code of conduct, basically for app developers in our industry, that say, you're going to be clear with your data, you're going to respect patient privacy, and just these unwritten laws kind of written down for us. And so a lot of the health applications have agreed to these rules. And you can check out more about the Caring Code of Conduct. If you go to myhealthapplication.com, you'll see all the health apps out there that have agreed to the Caring Code of Conduct.
Fantastic. That's another important piece of information, which is why, again, NeedyMeds is so passionate about this partnership, because certainly we believe that an educated consumer, when it comes to healthcare, is the best option. And as Brian said, if you would like to learn more about that, feel free to go ahead and check it out, just to educate yourself on it. And another question that NeedyMeds does get all the time, but this one is directed to you and Mylinks, Brian, which is, how does Mylinks make money?
Good question. Yes. So Mylinks, as everyone knows now, Mylinks is free. We don't make any money on it. It like I said earlier, it was a pet project of Debbie's, and we thought it was really powerful. We think patients getting engaged in their healthcare is a great thing. Studies have shown it produces better outcomes. So we didn't want to charge for it. So the way we pay the bills is with our other patient-linked products. So Mylinks is all about getting data out of the electronic health record systems, and then our other products on the patient-linked side are all about getting data into the electronic health record provider. So if you've ever filled out the medical record forms before you go into the doctor, your address and all those allergy questions, we can facilitate that and help inject it into their electronic health record system. So those products pay the bills, and Mylinks is really just a pet project that kind of turned into something bigger and felt like something we should really share with everyone.
Really important question, and again, another thorough and transparent answer, which we really appreciate. And as I said in the beginning, we are so proud to have this partnership with Mylinks, and really hope everybody that is listening not only signs up for it right away, but shares it. This can be used with family, friends, loved ones, providers, really anybody looking to manage, gather, and share their healthcare records, which, as Brian said in the beginning, there's easily, without even thinking about it, 6, 7, 8 reasons that might be super helpful. So as I kept mentioning throughout the presentation, we do try to keep the question segment brief. So again, if we didn't answer your specific question, you can be guaranteed that we will follow up with you by email, or you can always reach out to Mylinks or NeedyMeds through the contact information on your screen. With that, I want to thank everybody for making time to join us today to learn a bit more about Mylinks. And a thank you to my colleague and friend Brian for sharing his Mylinks expertise with the NeedyMeds audience. Thanks everyone so much. I do hope to see your name pop up on future webinars. Have a great rest of the day and take care. Thank you.
Thanks.